Greetings, professor and students, and welcome to my introductory video in regards to the Intro to Public Health at the University of New England. My name is Anthony Mounts, and over the next 8 weeks I will be working with you to gain a greater respect for public health. I'm married to a very supportive wife, Heather, and we have two young boys, Michael and Isaiah, as well as a little girl puppy named Lulu, and two guinea pigs, Harley and Speedy. I graduated from Briggs High School, originally from Columbus, Ohio, in 2003. Shortly after that, I joined the Navy, going through boot camp, and on to Hospital Corpsman A School. There I learned the basics of healthcare, bedside, as well as administrative, as well as basic aspects of disease surveillance and prevention, which has set the tone for my career over the past 13 years. I graduated from the Kaplan University with a bachelor's in psychology. Decided that I wanted to focus more on preventive medicine. I am a field medical technician by trade. However, in 2013 I specialized, and now I am a preventive medicine technician. So I'll go into that a little bit here in just a second. Taking a page from the professor's handbook, I have lived in many states, many countries. Most recent being North Carolina here, right? I'm getting ready to push out to Romania on a 8-month deployment into the surrounding areas of that particular country. Within that time, I've rendered preventive medicine care in the following: disease surveillance, food and waterborne illnesses, sexual health prevention techniques as far as STIs. I've also done health promotions is a big one, vector analysis, etc. If I had to narrow it down to where I think my niche is, it would be food safety, being that I've focused on that the majority of my time as a preventive medicine technician. And I mean, it's a multifaceted area, and that's why I love it. You have entomology, epidemiology, zoology, botany. I mean, there's so many different areas that you have to look at when you're looking at foodborne illness and epidemics and things like that. And when you think about it, from the time of the hunter-gatherer to what we have now, Center for Disease Control, multifaceted public health departments around the United States and abroad, the World Health Organization, etc. I mean, we've made a substantial amount of progress. However, we're not 100% there yet. That's why we're talking about it, and that's why it's still an issue everywhere, because we still haven't figured out exactly what we need to do to eradicate food and waterborne illness. Will we ever? Probably not. But I see it becoming better and better, judging from past principles and processes and things like that. My ultimate goal is to become an environmental health officer in the United States Navy, because what better way to spread the good word of public health across nations than in the world's greatest Navy. So, I continue to pursue this with vigor, poise, and intensity, if you will. And, I hope to achieve that. With that being said, we're talking about final projects. I see a lot of you have put out from the different areas which we're going to discuss. I'm going to go with smoking cessation in teens, as I do have some background in that. Being in the military, we do have young recruits that come through. They're 18, 19 years old. They've been dipping, smoking, using tobacco products, vaping, whatever the case may be for years. be it a cool thing to do or what have you, peer pressure. That's irrelevant. But what isn't irrelevant is the fact that they all want to stop smoking or using tobacco products. And so I'm looking forward to doing this project because I think that it's going to broaden my horizons. It's going to make me better as far as a provider, as far as a counselor, as far as just someone to speak with, a mediator. I guess the word you would be looking for is mediator. So I'd like to do all those things, and I'm hoping that this final project will aid me in that. As I said before, I look forward to working with every single one of you. I like to think that I have a lot of things to offer, and I look forward to seeing what you have to offer and reading the discussion post. Very interested in seeing what you have to offer. I look forward to reading all your posts. With that being said, let's broaden our horizons as a whole. Public health, right? Public health is where it's at. You know, it's very different than the medical field, right? We're preventing disease, whereas the medical field, they're treating disease as it comes up symptomatically, and I deal with that every day as well, working in the military. So if you have any questions, concerns, please feel free to respond to this video. I look forward to reading your posts as well as responses. And here's to public health. Cheers.